Thank you. Okay. Hey everyone, we'll get started in a minute. If you can hear me, I don't know.
We can hear you just fine.
Okay, perfect. All right. So welcome everyone. I see that everybody is here from all over. We're very excited to have you, and we'll just take you through some of the resources that you can use to study for this exam and how our company helps you prepare for that. So thank you so much for joining us today. We'll introduce ourselves. So I am Rishabh. I am a first year dermatology resident at Baylor in Houston, and I'll let my co-panelist introduce herself. Um,
So sorry, my screen just stopped sharing, but I'm Shauna Woman, and I am a third year MD PhD student at the University of Arizona.
all right, we'll just wait for the slides to come back up and then we can continue. Okay. All right. So, elite medical prep has been around for quite some time, and we actually have a lot of different tests that we prepare students for all the way from um, pre-med to like in your postgraduate and medical school and postgraduate studies. So we'll go from MCAT, medical school advising to USMLEs, and then both one, two, and three, all three of them, and then also complex level one, two, and three, and shelf exams, and we also do residency advising. So we have a lot of different services available for everybody along that journey. We also have some standing partnerships with some of these schools that we have on the side over here. We have UTMB, UNLV, Mount Sinai. So some of these we've had long-standing partnerships to be the company that kind of trains their medical students to take their exams, their standardized exams, and we're very proud of the relationships that we've cultivated with these medical schools. All right, let's go to the next slide. Okay, so what are some challenging step one topics? And of course, there's a lot of them, but we'll focus on some of them today. And we think that they are biostatistics, bioethics, acid-base disorders, and biochemistry. And now we'll find out why those are challenging. So basically, there's less emphasis in a lot of medical schools on teaching some of these, especially I feel biostatistics because it kind of always gets pushed to the side because there's so much other stuff to learn about. There's also a lot of mathematics and equations. So some people find that daunting. At the same time, I think because things can have a very definitive answer when you have like mathematics and equations involved, the exam likes to ask those questions because that's an opportunity for them to, ask you about something that they know that people may find daunting. And then, of course, wordy vignettes are always a problem, and that can also intimidate people. And some of these questions can be wordy, especially biochemistry. And then limited resource to review or learn from. That can always contribute to basically the mystery that surrounds these topics. And I will say that I do feel that maybe there's limited information on which resources to use, but there's always a lot of resources in terms of what you can use. And I think that's something that a lot of medical students and others in their medical journey struggle with because there's always such a resource overload, but there's no like strategic guidance that's just readily available on what to use to study for which topic. So, for all of these, I think first aid is the first thing that we usually recommend. But again, first aid can be a very dry resource, and a lot of medical students and post-medical students hate using first aid. So it is a good reference, but then you should always have other resources that you also rely on. For biostatistics, one of the ones that we've seen some of our students use is Randy Neal YouTube series. The other one that I've found very useful is Divine Interventions, Biostatistics Review. Yeah, he's done a great job explaining all the terms and truly understanding the meaning behind the statistical equations. Bioethics, I think first aid, of course, again, is there. There's Medical Ethics for the Boards by Conrad Fisher. And then UWorld and Amboss have bioethics modules. And I think Amboss does a really good job of having very dedicated bioethics modules that kind of go beyond what's available on UWorld, especially for step two, I feel. So would definitely recommend looking at that if you haven't. And then biochemistry, for sure, I would say the first two chapters of first aid have a lot of biochemistry in them, and I always recommend that if you're not reading the whole book, which I never recommend that to any of my students, definitely please read the first two chapters and try to annotate them or like try to get as much information as you can out of them because those are very, very high yield chapters for step one for sure, or level one. So that is something that, first aid for biochemistry is very, very important. And then acid base balance, acid base disorders, I think Boards and Beyond has very good videos on that. And there's a bunch of other ones that people use. Yes, someone raised their hand who, and how do we get that question? Okay, so what is the question? Did somebody have a question? No. Okay. Oh, you mean first two chapters in biochem? Yes, I mean the first two chapters in biochem. Yes, for biochemistry. They have a lot of high yield information that I would recommend going over if you're taking step one or level one, no problem. Okay, so let's keep going. Mhm. Okay, so we're just going to do some questions and kind of, go through these questions and then talk about resources that we have available through our company. So basically, a new biomedical research company called OSI develops a novel test to detect ovarian cancer at an earlier stage. This test is positive in 90% of patients who are diagnosed with ovarian cancer by the current gold standard test. In addition, the OSI test is positive in 15% of patients who do not have ovarian cancer. The prevalence of ovarian cancer in the study population, which is 1,000 patients big, is 2%. What is the specificity of the OSI test? So I think we have holes that will record your answers. So if you guys can enter them, that would be great. Okay. 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 So I wonder if you guys can see the results of the poll. So you can. Okay. Perfect. So we seem to have a winner in option B, which is the correct answer. Excellent. So basically, you can think about it in two ways. One, and I guess we can go to the next slide, which kind of goes into it too. But and the following one after that. Yeah, so basically, you can do it by two ways. One is by looking at the formula, which can be like true negative over true negative plus false positive, which the question does give you because it tells you what is the actual result based on the gold standard test. And then you get the true negatives from there, and then the false positive is also given. So you calculate that to get 85%. Or you can go by the definition of specificity, which I would recommend knowing the definition too, because sometimes they ask you to explain what each thing means biostatistically. So for specificity, the exact definition, and it's always specificity of a test, is of all the people without a given disease, what percent have a negative test result. So that's going to be your definition. So if we go back to the question and look at it, um, you can see that so it says that the oocyte test is positive in 15% of patients who do not have the disease. So what does that mean? That means that it's negative in 85% of patients who don't have the disease, right? So then that becomes your specificity. That is the definition of specificity of all the patients, of all the people who don't have the disease, what percent have a negative test result. And then for sensitivity, it's going to be of all the people who do have a disease, what percent have a positive test result. Okay. That in that case, yeah. So the answer is 85%, which most of you got. Okay. So next question. Okay. So a company recruits 800, or actually before we do that, did anybody have a question on that? No. Okay. So of all the so a company A company recruits 800 factory workers and divides them into two groups. Okay. 400 workers who work with the original chemicals and 400 workers who work with a new set of dry cleaning chemicals. Allocation of participants into one of these two groups is decided by a coin toss. So, which of the following best describes the type of study design? All right, so I believe you all can see the results of the poll, and we have a clear winner in, well, actually, we have a tie between a case control study and randomized control trial. Yes, so, you know, for randomized control, so basically it's in the name, right? So randomized control trial is when you randomize people to two different groups. And that is exactly what we're doing over here. So two groups are being decided by a coin toss. You're tossing the coin, deciding which group the patient is going to be placed in. You don't really get that option in case control studies because you're literally like the groups are predefined, and whoever meets the criteria for, the person who may have had an exposure versus not, will already be decided based on their history. You're not assigning those people. In a randomized control trial, say for a drug intervention, you're going to decide people who are going to get the drug and people who are going to get the placebo. So it can be anybody, so you don't have any kind of like pre-requirements for people who are going to get the placebo or out of a given population. Everybody probably has, say, brain like glioblastoma, and you're trying to do a randomized control study. They're all going to be the same type of patient, and you're going to just decide based on a coin toss, basically, who gets the placebo, who gets the real drug. And by placebo, they probably are getting like standard of care, not just like nothing, because that would be unethical. So that that's the way you would do the trial for that. Um, but yeah, so there has to be like random chance of assignment, which is what a randomized control trial is, which is what this coin toss is representing. Okay, next slide. Okay, yeah. So basically, this is kind of discussing some of the other ones, like what each one of them means. And so basically, you look at the diseased versus the non-diseased group, which again is predetermined based on their history. You're not determining that. And then you're evaluating their exposure history. So that's going to be your case control. Cross-sectional studies are usually just done in a moment in time, and you're just, again, looking at exposed versus unexposed and the disease prevalence. Prospective study is usually done, like, again, as the name suggests, like into the future, again, exposed versus unexposed. And then the retrospective cohort study again is going into in the past. And then the randomized control trial usually has an intervention, and you are randomly assigning, which is why it's called randomized control trial, to one group or the other. Okay, I'm gonna let Shana take over from here.
Okay, thank you. So sorry for skipping through some of these questions. Up next, we have our first bioethics question. And my spiel about bioethics is that I think a lot of students feel a bit of fear about answering these, that they'll get them incorrect, especially if you haven't had the chance to be on the wards yet, practicing this day to day. So, my big piece of advice before you get a bioethics question is first of all, go with your gut. Most of the time, I see my students second guess what the most natural human thing to do is, and they think there's something they're missing. And it's really not the case. Go with your gut. The second thing is that patients don't know all of the jargon that we know. It's pretty easy to get disconnected from that. So, likely an answer that is too in the weeds about details is going to be incorrect. You know, a patient is on a need to know basis. Um, and I think the third thing is a lot of these questions are getting at a fundamental problem of autonomy and giving patients autonomy to make their own decisions. So your gut is probably already telling you that you don't get to just tell a patient what they're going to do, but avoid any answer that is deciding for a patient. You know, at the end of the day, the patient gets to decide what's right for them. So go ahead and take a stab at this first question, and let's see where we go. Okay, about like 15 more seconds to answer. Okay, great. I think we have a lot of people who are sticking with B, which is what I would choose as well. So, you know, like I said, trust your gut. This patient has come in with a lot of information. They've probably felt like they were not listened to in the past. And so, you know, it can be difficult. This question reads like they're coming in for a specific type of diagnosis, but you owe that patient the opportunity to understand that fully and completely. I know some people might have chosen C. I'm not familiar with chronic fatigue syndrome, except that many physicians don't think it's a real disease. Remember that everything you say as a physician is a seed in a patient's mind. So you don't necessarily need to know, tell them that in order for them to feel heard, you know. So remember, keep it simple, be clear, give the patient autonomy. All right. Second bioethics question. We have this 26-year-old woman comes to the physician. Let me see if I can get this poll up so you guys can answer. Ah, there we go. All right, about 30 more seconds. Okay, sweet. Well, this is a great opportunity, I think, to review how I would review this type of question, even if it's not a bioethics question, because you might even imagine the last sentence being changed to something like, what is this patient at most risk for, or what have you. So when I read a question, I'm sure many of you are familiar with the idea of reading the last sentence first. That's how I still read mine, even after taking step one. I think it's helpful for priming yourself so you know in advance this is going to be a bioethics question, even if I didn't ask you. 26-year-old woman with a mother and three of her five siblings have type 2 diabetes. Okay, that's concerning. We have family history. She's 5'7" and 180 pounds, BMI is 28 kilograms. So, you know, we might be thinking or BMI is 28, we might be thinking that she has a higher BMI, she has a higher blood pressure, she has a higher resting glucose concentration. So obviously, we think that there might be a risk of type 2 diabetes. When you're doing this type of question, what can be beneficial is even though it's a bioethics, ask yourself why would we not want a woman with type 2 diabetes to get pregnant? What could be some possible complications? My main concern was that her blood pressure is pretty high or high before she's pregnant. Um, and so out of all the options, I like A the best. I think that's our best option. Let's review ways you can optimize your own health before conceiving. We don't objectively know that anything's wrong. We don't know whether or not she has diabetes at this point. So saying we should test you for islet cell antibodies before you try to conceive, again, is getting at that too jargony answer. You should avoid gaining weight during pregnancy because you are already overweight is a great way to isolate your patient and have them, potentially not want to have a conversation with a physician about conceiving in the future. We want them to keep coming back. So, um, and that's the way to go. And you should not have problems with your pregnancy if you start insulin therapy. No one answered this, but obviously we need objective data before we give her anything. So, again, my biggest piece of advice for bioethics is give that patient autonomy and also, give them the opportunity since it's their body to come on board with what the right choice is. Okay, so that's bioethics. Not so scary after all. On the other hand, acid-based practice. So this is a big problem for a lot of my students. They don't know how to do it. Maybe the way you were taught in medical school was rough. It might have been the first time you ever experienced this. So, what I really encourage doing, in addition to the resources that were mentioned at the beginning, is doing multiple sets of UWorld practice questions, 5 or 6. And I think you can really start hammering down some themes. But I'll walk through how I like to do this after I get a sense for how you guys are doing. So take a stab at reading this, answering this question, and then I'll tell you sort of how I go through it, especially with clinical knowledge. Okay, probably about like another 45 seconds. I'm giving you guys a couple minutes on this one because I know acid base is a challenge. Okay. All right, we have some mixed results on this one. So I'm going to try and break it down nice and slow so that everyone's on the same page. So, the first thing I like to do when I'm going through an acid-based question is to try and make a stab at a diagnosis before I get to the questions, or sorry, the answer choices. You don't have to do this, but I think it helps me sort of guide the numbers, and help me keep an eye out for what I'm my potential diagnosis is. So this 23-year-old man. He has a high heart rate. His blood pressure is low. He's been drinking fluids and urinating excessively, but he's still losing weight. He's thin and he's afebrile. He's showing lots of signs of dehydration, his dry mucous membranes, his poor skin turgor, his low blood pressure, his high pulse. I'm thinking that he's definitely dehydrated. And also at his age range, I would say that one of the differentials on my list is type 1 diabetes. And this is a very classic presentation of diabetic ketoacidosis, particularly The difficulty breathing, the vomiting, the confusion, the excess water consumption, but he's still losing weight. Now I go and look at the labs. If you can, I would avoid looking to the labs as long as possible until you kind of orient yourself, because a lot of students get lost when they do this. First thing is glucose. Glucose is a great place to start if your differential includes diabetes, and this person's glucose is 400. So that pretty much confirms to me that he is in diabetic ketoacidosis. The next thing to answer this kind of question is what is the pH? So the normal pH is 7.35 to 7.45. So at 7.21, he's acidemic, which is also confirming that he has diabetic ketoacidosis. So my primary diagnosis is that he is in metabolic acidosis. Now, at this point, you might be like, nailed it. It's metabolic acidosis, moving on with my life. However, we need to consider the possibility of a mixed picture. And the only way you can do this at this point is using Winter's formula. So when you have a metabolic acidosis, you then want to use Winter's formula to figure out whether or not this patient is compensating appropriately. What does compensating mean? So this is a confusion point for a lot of students. When you are in metabolic acidosis, you have this increase of the H plus, the acid. Ideally, your body should be compensating by getting rid of some of the CO2 in the body. CO2 is also acidic, and that's what we call like respiratory compensation. But some patients are unable to do so, and they can enter both metabolic acidosis and some sort of respiratory problem. And this is a big issue. But the only way you can figure out whether or not that's true is by using Winter's formula. So Winter's formula is PCO is equal to 1.5 times HCO plus 8 plus 2. If at this point you're like, I don't know what she's saying, I just wanted you to put it in your mind that if you're looking at a metabolic acidosis picture, you need to use Winter's formula to confirm whether or not the compensation from the respiratory system is appropriate, and that is what you will get. When the result of Winter's formula, you'll then look at the PCO2 and see whether or not it's above or below that range we would expect. According to my calculation, the expected PCO2 for this patient is 21 to 25. So the PCO2 is 30. That's quite high. That's telling me that this patient is not blowing off enough CO2. They're not compensating. So this is a picture of mixed metabolic acidosis and respiratory acidosis. The first problem is that we have ketones in the blood. Those ketones in the blood are increasing acids. Our bicarb is trying to buffer those acids, which is why our bicarb is a little bit low. We would hope that the lungs would compensate by blowing off CO2, but unfortunately they're not. And because CO2 is also acidic, we have a combined metabolic acidosis and respiratory acidosis picture. Pretty rough. So I really encourage you to work on a handful of questions with this. Get comfortable with what lab you feel most capable of informing your picture. And getting comfortable moving these numbers around in your head. So just to emphasize again, not to beat a dead horse, but start with your pH. I then like to jump right into calculating my Winter's formula to see if there's compensation. You can check your bicarb and then also your PCO2 to confirm your answers. Okay. Oh my goodness. And this is a great picture from first aid that's going to give you information about all of the different possible drop-down menus for acidosis or alkalosis. Like I said, since we're in this metabolic acidosis picture, you can identify that this is an increased anion gap diabetic ketoacidosis. if you're doing targeted UWorld questions about this specific subject, I think that this is a great figure to have open to highlight. And this also would make a great closed deletion Anki card too. Okay, next question. We have this 3-month-old girl. So this is biochemistry. My spiel on biochemistry before we start. This is the one where if you have not, looked at Sketchy as a resource before, I think it can be very helpful in differentiating all these very similar, diagnoses. On the other hand, I really encourage you to think through why the symptoms are so similar but just have like slight differences. Um, when you're talking about your glycogen storage diseases or your lysosomal storage diseases, there might be a slightly different enzyme that's impacted. And that's going to result in symptoms that look kind of similar but are just divergent enough. I think a lot of students have success remembering them when they really try and think about like, if this enzyme is defunct, then why is it causing that symptom? So I'm hoping that I can sort of outline this and make that clear during this question. So give it a stab and then we'll talk about it. Okay, and another like 15 seconds. All right, sweet. So, if I hadn't given you the warning that this was a biochemistry practice question, you might be considering all of these options. I'm going to tell you how I read this question and then sort of work backwards so that we can pick the right answer. So, 3-month-old girl, she has poor head control and weak muscle tone. We call this hypotonia. The point of maximal impulse is at the left anterior axillary line. This tells me that she has some cardiomegaly for her age. And then she also has hepatomegaly because her liver edge is palpable, but the spleen is not. Okay, great. What I like to do in this kind of thing is eliminate, make yourself life easier by only picking the things you are, sort of sure are going to be on your list. For me, ventricular septal defect, I don't have any reason to believe, based on my clinical knowledge, that VSD is going to cause hypotonia. And same with hepatomegaly. So I would take that off my list pretty soon. Infant botulism, that is possible, but a couple things. This is not a hard and fast rule, but often on STEP, they're going to mention something that's a risk factor for botulism. Great example is going to be, I think one I see a lot is cutting the umbilical cord with a rusty knife or like using poorly canned products. So that's kind of on my back burner here. Congenital muscular dystrophy also on my back burner here because I think of that as a later presentation, calf hypertrophy in something like Duchenne's. But glycogen storage diseases, this is right where the money is. This is the right age range and also the right set of symptoms. So these three are all similar in their presentation if you haven't taken the time to study them. So this is a good example of Pompe disease. So we have this combination of hypotonia, cardiomegaly, and also hepatomegaly. And the reason that this three set of symptoms comes together is because there are You have difficulty with lysosomal acid maltase. So you can't degrade glycogen in lysosomes. And this causes accumulation of glycogen in muscle cells. On the other hand, something like von Gerke, the thing that always gets me with von Gerke is the use of the word doll face. Um, and then they have hepatomegaly, but they will not have cardiomegaly. Um, Part of the reason this is true is because there are deficiencies in glucose 6 phosphatase. So you essentially get glucose stuck in the liver. That's why the isolated symptom is going to be hepatomegaly, um, without cardiomegaly. Remember, the last one was lysosomes and muscle cells, and this one is liver cells. And then last but not least is Cori disease. Cori disease is a deficiency in the debranching enzyme. So the symptoms are far less severe. They'll have muscle weakness because they can't mobilize their glycogen efficiently. But this is generally speaking one of your kind of less intense diseases out of the three options. Again, I really recommend if you are a sketchy person to take some time to watch those. Those can be helpful to remember all those tiny details. But yes. Um, and then this is our little chart. Oh, this is what I needed. Again, von Gerke is going to be our severe fasting hypoglycemia, hepatosplenomegaly. Like I said, this is the most common. And also these symptoms precipitate from a sequestering of glucose into your liver. Type 2, Pompe, cardiomegaly, hypertrophic cardiomyopathy, hepatomegaly. This is due to the sequestering of glucose into lysosomes and poor mobilization. And then Cori is a problem with the deep branching enzyme. So you have difficulty mobilizing glycogen. Um, right. I would love to open it up to any questions you guys have about either the content that we covered today um, or any other questions about studying. I also wanted to mention that as a part of this webinar, you'll be getting a 600 card Anki deck that was curated by us at EMP. It is a sort of like a pared down version of the same Anki cards you would expect to see. This is great if you're at the beginning of your study period when you are trying to figure out all of the highest yield information, but also great if you're at the end of your study period and you just want to look at the Anki cards that matter. Um, so that's it for me, and I'd happy to take any questions.
And I just wanted to add a couple more things. So for the Winter's formula that Shana was talking about, I think for when you're calculating the formula, it's as she said, it's like the expected PCO2 is 1.5 times the bicarb plus 8, but then you do a plus or minus 2 because then that's how she calculated the range. And then for the other one, for the one about the botulism, I think for the most part, it's like associated with, if it's like a young baby and they were given honey, or like, they live in an endemic area where like it's a baby and there's a lot of botulism in the spores. But I think in terms of the the risk of clostridial infection with cutting the umbilical cord with a rusted knife, from what I've read, I think it's more likely to be seen with Clostridium tetani, which causes tetanus.
Um,
Right.
Thank you for clarifying. I did think when I say that, I was like, I might be getting my wires crossed. What I was thinking of was the honey. Thank you.
Yes, yes, yes. I just wanted to clarify this. Thank you guys for listening.
Well, if there aren't any questions, I would highly recommend using our EMP vetted Anki deck, like I mentioned. This is a pared down version of the 20,000 Anki cards. Um, I think this will be a great opportunity for you to either start your studying or end it. Um, and we really appreciate you guys taking the time to come meet with us today. There will be a PDF of the deck with the recording after we're finished. So thank you all again.
Thank you so much.
Oh, I did want to mention, if you go to the next slide, there's one more. We are actually running a contest on our social media accounts. We're offering it on Instagram and Reddit. So if you are interested in participating, you just need to follow us and like and share the post. You have the possibility of winning a free tutoring session. So if you're not already following us on social, please do that. And we'd love you to participate in the contest as well. Additionally, if you need more information about Elite Medical Prep, you can reach out to us at elitemedicalprep.com/contact to schedule a free consultation. We also have more webinars coming this spring, and we'd love to see you all there.